Hey guys, welcome and welcome back to my YouTube channel. So guys, let's continue with interview series. So I'm going to tell you some of the 10 common nursing interview questions to help you practice and prepare before an interview. So during your nursing interview, expect to be posed questions about patient care, your nursing skills and experience, crisis management, things like those. So the interviewer's goal is often to see your level of compassion, how you function in stressful situation, and the critical skills you possess that will make you successful. That will make you a successful patient care team member. And these could be adaptability, integrity, accountability, among others. So let's start with number one. The first question that they will ask you is, tell me about yourself. I've already talked about this in a specific video, but I will just say something about it. You must focus. If someone asks you about, tell me about yourself, you answer this as, thank you for giving me this opportunity. My name is so and so, and you focus on your education, your goals and skills. So those are the things you should focus on when answering this question. And when answering this question, also focus on something about yourself that relate to the nursing role you are interviewing, or nursing role that they are interviewing you about. For instance, if the position require meticulous attention to details and close monitoring of patient, and you are very detail oriented, emphasized that quality and how it help improve patient care. The second question that most of the interviewers will ask you is, what do you love most about being a nurse or nursing as a profession? The interviewer want to hear your passion for nursing. So let it shine. Focus on what make your work meaningful, such as patient relationship and opportunity for growth. You will want to talk about why you chose a career in nursing too. This is an essential part of your career narrative. So you must tell them the reason why you chose nursing as your career. The number three, they will ask you, what is your most significant achievement as a nurse? The interviewer is looking for instinct into your work ethic and character with this question. The question is really, how do you define achievement? Talk about something related to nursing that you have done which made a different or positive impact to someone's life. Like your answer back to back competence required in this in the job role. Number four, another thing that most interviewer will ask you, what make a great shift? This question is designed to see if you understand what goes into the day-to-day activity, duties of a nurse, and how you feel about teamwork and collaboration in the workplace. Share your thoughts on what makes an effective team effort and why that make a great shift. Give examples from your past shift that were challenging. rewarding, and learning experience. Some of the competency you might want to communicate in your answer include work well with others when under pressure, communicate effectively to improve care, stay organized when managing a heavy level of care, stay calm under pressure, among others. Number 5, how would your colleagues and patient describe you? This question aims to understand who you are and how you work. When answering this question, think about what makes you a good nurse. Focus on your nursing skills, such as being able to multitask, being able to be adaptable, having strong communication skill, remaining positive, among other good nursing roles or skills that you can mention. Number 6, what do compassion and care mean to you or mean for you? Nursing is a job that requires compassion and care above all else. This question is asked to ensure that this is part of your core personality. Make sure that you demonstrate empathy in your answer and discuss how being kind to others makes the job easier for everyone involved. Give examples of how you've shown compassion and care for patients. Number 7, another question that they will ask you, tell me about your working relationship with other nurses. Nurses need to be able to work well with other medical staffs. When answering this question, discuss how patient care works best when everyone works together. You may also want to discuss how important it is for nurses and doctors to communicate with each other properly so they can provide the best patient care. How do you manage working in a high pressure environment? That is also another question that they might ask you. An excellent way to answer this question is maybe say, I am very well organized, which help me prioritize my workload and manage my time efficiently. I can identify potential problems early and solve them quickly. You can also recognize that job can be very challenging at times and describe how you will maintain your health and wellness through getting enough rest and exercise and making time for hobbies and socializing. Tell me about a time when you had handled a difficult patient. This is common in the hospital, where maybe sometimes you have a patient whose relatives are learned and they want to know everything that you are doing to their patient. So the interviewer want to know how you can handle a difficult patient and maybe their relatives. You could mention a case where you reconcile conflicting priorities with the patient or their families, or you needed to take an extra time with an anxious or worried patient. The answer must show you empathize with the patient and can think on your feet. Demonstrate that you understand that patients may be behaving a certain way because they are in pain, are feeling anxious, or struggling to deal with a certain difficult condition. The interviewer wants to hear how you dealt with a situation that most nurses will find hard to handle. Talk about your active listening skills, ability to probe questions, and then capacity to reassure patient and even use a sense of humor when appropriate. And the last one is number 10. How would you respond to a distressed relative? The interviewer wants to know that you can deal with emotional situation and have So I was saying the interviewer wants to know that you can deal with the emotional situation and have experience doing so. If you do, the part to be Part of a team, you need to be willing and able to take responsibility for challenging aspects of the job. The interviewer also wants to see that you have techniques and a vocabulary that help you deal with the distressful relative, and that you can adapt your tone of voice and body language to a situation. A great answer may say, it is important for a relative to understand what is happening and come to terms with the situation. I will explain what had happened, why it had happened, and how we will treat the patient. I would adapt my tone of voice to be softer and lower, often support and offer support by listening to their concern and answering any questions they may have. I think I'm gonna stop from there. I may come back with some of the questions also. This is just part one of this video. So if you've not subscribed, kindly subscribe, like, share, comment, and most important thing, turn on your notification bell so that you get notified when a video is posted in my channel. Bye till next time.